Hello everyone, and welcome to our video on taping techniques in sports injury management. Participation in sports and physical activities plays an important role in maintaining physical health, mental well-being, and overall quality of life. From school sports to recreational and competitive activities, being physically active is highly encouraged. However, along with these benefits, sports participation also comes with certain risks. Injuries such as muscle strains, joint instability, swelling, and overuse injuries are common and sometimes unavoidable. Sports injuries not only cause physical pain but can also affect an individual's confidence, performance, and daily activities. When injuries are not managed properly, they may lead to prolonged recovery, recurring injuries, or reduced participation in sports. Therefore, effective sports injury management ensures a safe and timely return to activity. One of the most commonly used and practical methods in sports injury management is taping techniques. Taping is widely applied in sports medicine as both a preventive measure and a supportive treatment after injury. When applied correctly, taping can help reduce pain, provide joint stability, and support proper movement patterns. In this video, we will demonstrate three main taping techniques used in sports injury management. The first is rigid taping, which provides strong external support and restricts excessive movement, especially during the acute phase of injury. The second is general kinesiology taping, which is more flexible and supports muscles and joints while allowing natural movement. The third is edema kinesiology taping, which focuses on reducing swelling by encouraging lymphatic drainage and improving circulation. These techniques are commonly used not only in professional sports but also in schools, colleges, and community programs. Through this video, we aim to provide a clear and practical understanding of taping techniques and highlight importance in managing sports injuries.
For this section, we will demonstrate rigid taping, which is commonly used in sports injury management to provide strong support and limit excessive joint movement. Rigid taping is especially important when a joint is unstable or at risk of further injury. It helps protect ligaments, reduce strain on injured structures, and prevent movements that may worsen the condition. This type of taping is often used during the early stages of injury or when an athlete needs additional support during sports participation. In our demonstration, we have chosen the elbow and ankle because these joints are frequently injured in sports due to falls, overuse, sudden impact, or incorrect movements. Through this demonstration, we aim to show how rigid taping is applied correctly and safely to provide effective joint stability. We begin the rigid taping procedure by first checking the skin around the elbow and ankle to ensure there are no cuts, rashes, or irritation. The skin is then cleaned and dried thoroughly to allow proper tape adhesion. A pre-wrap is applied around the elbow to protect the skin and improve comfort. Anchor strips are placed above and below the elbow joint without tension to create a stable base. Rigid tape is then applied firmly across the elbow joint, following the joint structure to restrict excessive movement while still allowing basic function. Next, the ankle. Next, the ankle is prepared in the same manner. A pre-wrap is applied, followed by ankle strips above and below the ankle. Rigid strip is then wrapped around the ankle to provide medial and lateral support, which is important in preventing ankle sprain. Once tapping is completed, the tape is pressed gently to secure it. Comfort and circulation are checked to ensure the tape is not too tight. So, in conclusion, Rigid taping is effective in providing strong joint and stability and protection. When applied correctly, it helps reduce the risk of further injury and allows safer participation in sports activities.
General kinesiology taping. This section focuses on general kinesiology taping, which is designed to support muscle and joint without restricting natural movement. Unlike rigid taping, kinesiology taping works with the body's natural mechanics by assisting muscle function, improving circulation, and reducing muscle fatigue. It is commonly used during rehabilitation, injury prevention, and physical activities. In this demonstration, we will show Y-shaped kinesiology taping at the calf and donut shaped taping at the knee, which are widely used technique in sport injury management. The skin over the calf and knee is cleaned and dried to ensure proper adhesion. The kinesiology tape is measured, cut accordingly, and the edges are rounded to prevent peeling. For the calf, the tape is cut into a Y shape. The subject is positioned so that the calf muscle is stretched. The base of the tape is applied without tension, followed by the two tails applied along both sides of the calf muscle using light to moderate stretch. This supports muscle function while allowing free movement. Next, donut shaped tapes it demonstrate at the knee. With the knee slightly bent, the donut shaped tape is applied around the patella without excessive tension. This technique helps reduce pressure around the kneecap while maintaining joint mobility. The tape is gently rubbed to activate the adhesive and the movement is checked for comfort. In conclusion, general kinesiology taping helps support muscle and joints while allowing natural movement. It improves comfort, reduces fatigue, and supports safe and efficient movement during daily activities and support. Type 3 Edema Kinesiology Taping. For the final section, we will demonstrate edema kinesiology taping, which is used to help manage swelling after injury. Swelling can cause pain, stiffness, and limited movement if not managed properly. Edema taping works by promoting lymphatic drainage and reducing fluid accumulation in the affected area. In this demonstration, we will show octopus-shaped taping at the wrist and foot along with additional support techniques and enhance effectiveness. The wrist and foot are first checked for swelling. The skin is clean and dried thoroughly. For the wrist, kinesiology tape is cut into an octopus shape. The anchor is applied near a lymphatic drainage area without tension, and the straps are gently placed over the swollen area using minimal stretch. And additional eye-shaped tape is applied to provide extra wrist support. Next, edema taping is demonstrated at the foot using two octopus-shaped tapes. The anchors are applied near the ankle, and the fan-shaped stripes are laid gently across the foot with minimal tension to encourage fluid movement. The tape is smoothened to ensure comfort and proper adhesion. In conclusion, edema kinesiology tape is effective in reducing swelling and improving comfort after injury. By supporting lymphatic drainage, it helps to reduce pain and allow better movement during the recovery process.
In conclusion, this video has demonstrated the importance of taping techniques as an essential component of sports injury management. Through the demonstration of rigid taping, general kinesiology taping, and edema kinesiology taping, we can see how each method serves a specific purpose depending on the type and stage of injury. Rigid taping is effective in providing firm support and limiting excessive movement, especially for unstable joints. General kinesiology taping supports muscles and joints while allowing functional movement, making it suitable for rehabilitation and injury prevention. Edema kinesiology taping plays an important role in reducing swelling and promoting the body's natural healing process. Proper knowledge and correct application of taping techniques are crucial to ensure safety, comfort, and effectiveness. When used appropriately, taping not only helps in reducing pain and swelling, but also increases confidence and supports safer movement during sports activities. Overall, taping techniques are valuable tools for students, educators, coaches, and sports practitioners in creating a safer sporting environment. We hope this video provides a clear understanding of how taping techniques can be applied effectively in sports injury management. Thank you for watching.